I'm Dr. Arien van der Merwe. I'm a medical doctor, but I specialise in natural integrative medicine, and I've also just registered as a specialist holistic health counsellor. The integrative approach incorporates body, mind, emotions and soul, and then the holistic counselling is then of course addressing those aspects in a holistic or a whole human being approach rather than just looking at a few symptoms here and there and trying to manage that. Heart health is an excellent example of an holistic integrative approach because first of all, we will start with physical. That's where we always start because it's easier also for people to relate to. People that carry a lot of anger within and resentment and frustration. And those are the crucial underlying causal risk factors in heart disease. Once we've got the screening, we will do the corrective supplementation, also other natural remedies, and then herbs specifically that are suitable and applicable. It would be follow up with the blood screening, for instance, and then the in-body to assess the fat percentage and the osseous or the bone mineral content. Then we will move into stress management, relaxation training, which incorporates the mental, emotional. And when people are in that process, we will even move a little bit deeper. One important thing already leading to other functions of the heart is that before the heart pumps the blood to the body, it pumps it to itself. That's an act of self-love. It's not selfish, because if the heart didn't do that, it wouldn't have been able to support the whole body. The heart is more of a brain than what the brain is. 65% of heart cells are actually neurons. So similar to what we would find in the brain and actually the whole nervous system. So the heart actually is a brain that informs the brain that we know as brain and the whole body in a consistent two-way 24/7 communication. So very important, the field of the heart is also extends from the body about 20 meters. The brain only has a field of about 2 to 5 meters. And then the heart's also an endocrine gland. It makes hormones. So it makes natriuretic factor that again informs the brain and the body constantly. So it sends messages. And that brings us to why it's so important also to deal with the heart in its health aspect, into understanding and being aware of how we think and feel. Hi Ricki, yes, welcome here again. I mean, it's time for the annual screening that you've been doing now for nearly 6 years. Ricki came to me because of her high blood pressure. I started her then on the natural remedies. We followed up very regular, like even weekly in the beginning, but all high blood pressure has got underlying stress. That is just a fact. So to treat the high blood pressure with anything, mainstream or natural, is like covering things with a little band-aid. You've got to dig deeper into the cause, because the heart is contracting and even pumping, and it increases the pressure in the systolic, which is where it contracts, and it increases in the diastolic, where it actually is supposed to relax. And that's the most warning one, is the bottom line, as we talk about, because it shows that the heart is not relaxing.
I always felt tired. I tend to get headaches. My whole being was sometimes I just felt that I couldn't focus properly on things, don't remember things even.
For somebody like Ricki with high blood pressure, the main purpose is to prevent heart attack and stroke. So we were working through that process of understanding also that the whole purpose is to prevent the health risk associated with the more serious health challenges. With Ricki, we started on the basic physical things. So we looked at at eating and encouraging her to exercise, and then very important stress management and relaxation. And then I prescribed the optimal 3, the basic 3 for optimal health bundle with our very strong antioxidant that's also got ginkgo biloba in and coenzyme Q10 and all the other antioxidant vitamins and minerals for heart health, and then the omega-3 from fish oil. She is on a hypertension formulation, also then the herbs in combination that works for her. So there are various different herbal remedies that I will adjust and adapt to the patient's specific needs. So what we'll do now is we'll do the follow-up of your blood pressure, and then also looking at the screening procedure for your in-body, because that's important to look at fat percentage and then also the osseous, the bone mineral content.
My name is Arien and I'm the Health and Fitness Scientist at Arien Health Solutions. So I do work closely with Dr. Arien, as in I see all her patients before they go in for their consultation with her. Now in this session I basically do a basic health screening, so therefore I include blood pressure, blood sugar levels, and then I also do an in-body as necessary depending on the patient and the condition. When Ricki van Berg first came in, it was 5 years going on 6 years now. So she, compared to then, her heart health risk factors improved quite drastically. When we look at her blood pressure, it improves. When you look at her in-body, it also improved. When we look at the in-body there, the body composition, the fat mass is very important. So we can actually see that her fat percentage also decreased specifically, which means it decreases the load on the heart itself. So it also improves heart health in that sense. Basically, the in-body gives us a body composition analysis, which means it's much more than just total weight. So it gives you the different components of the body, which is your water, proteins, minerals, and fat. And when we look at heart health specifically, we focus on mineral content, so that's osseous as well, because that gives an indication if the calcium magnesium levels are optimal in the body, which plays a crucial role in heart health itself. So if you compare yours now with 4 months ago, you can see that your water content is up with 1 kilogram. It still falls within the norm, so that's good. Do you drink a lot of water?
I do take a lot of water, yes.
Okay, great. Okay. So we can see that.
When I started doing this high blood pressure treatments together, especially with the relaxation, breathing, and everything together with that, I started to feel that there's so much improvement. And eventually, being for 6 years already, I feel wonderful, and it's still going on.
When we talk about natural integrative medicine, we always say be patient, but doing the breathing exercise is a quick fix if ever I've seen one, and then you take it from there to learning the skill of maybe longer meditations, and then of course using natural herbal remedies that are suitable and prescribed for you. So there's so much you can do, and then start exploring all the other body-mind therapies that are available.